Welcome to the Low Carb MD podcast. No one is beyond help. No one is beyond hope. Nothing said on the Low Carb MD podcast is medical advice. Please consult your own doctor before making any lifestyle changes.
Hello and welcome back to the Low Carb MD podcast. Tro, we have a smart kid here.
Listen, I got to be honest.
Awesome.
I remember maybe like 10, maybe more, over 10 years ago, reading her website and thinking to myself, who is this? And how did she come to these conclusions? And then as every year passed by, 2012, 2013, 2014, 2015, 16, 17, I'm like, oh my God, she's more and more right. And every year that I learned more, I'm like, I was just, in awe of, and it came to a point, I think, she came on our podcast. She was one of the first 20 guests, and we talked about mental health, largely inspired by you, by Dr. Georgia Ede, who we'll introduce in a bit. And we got so much flack, Brian, for talking about food and mental health.
Oh, food addiction, mental health, drug addiction. I think that the thing that got controversial because you were mentioning that one of your several of your patients said they stopped pornography when they did ketogenic diet. You're like, well, what? But you look at this, that was there, and gambling and different things that we saw, these risky behaviors, and they say, yeah, I don't need that anymore. I feel calm and I feel good. And then Dr. Ede here, I saw her talking about this. I'm like, oh my goodness. My first conference, I was looking at diabetes reversal. How do we fix diabetes? Because we know that's a major problem. And George is there talking about this. I'm like, holy cow. And I got to sit next to her. I got there late for one of the afternoon sessions. I'm like, oh my God, I'm sitting next to Georgia Ede. What am I going to say? And then she was so nice to me.
Well, let's give her a proper,
so cool.
let's give
Awesome.
her let's give her a proper introduction. She is a psychiatrist with over 25 years of clinical experience. She is also a nutrition consultant. Since the last time she's been on, she is a best-selling author. Okay, please go buy her book. Okay, we'll put it in the show notes if you haven't already. And she continues to publish in the mental health and psychiatric space. A very recent publication that we'll talk about, but a publication a little over a year ago looking at how ketogenic diets can drastically improve, how they drastically improved mental health, severe depression, and even some psychosis symptoms, I believe, in a cohort in France. So, and to make things even more fun, more interesting, we've worked together on some collaborations to bring metabolic health to the forefront of our government. And also, we will both be presenting, and I can't wait for this, in the UK at the Food Addiction Conference put on by Dr. Jen Unwin. And we'll put the link in the show notes, so you all can come join us or join us virtually. Hopefully you'll join us in person, but at the least join virtually. So I'm rambling here. I'm so excited to have Dr. Ede back. It's always a pleasure to get some time with you, and I can't wait to get even more time with you.
I love it. I really so many of the projects that we've all been involved in, some of us individually and then together, it's just incredible to me how fast this movement is growing. And it's partly because we're working hard in this space, but it's partly because the truth will out, right? So the you were saying that, we've been talking about these truths, some of them are not, some of them are surprising to people, some of them are controversial, but the truer something is, the more it will spread, and because it actually works and it helps people. So if you're correct about something, you'll see the evidence for it all around you. And the beautiful thing about this day and age is that just like bad ideas can spread online, really good ideas can also spread really fast online. And so people are sharing this information, learning for themselves, bringing information to their doctors and saying, hey, I heard about this ketogenic diet for mental health. Is that something that, that I could try? Because these medicines aren't helping me enough, or I've got side effects from these medicines, or I just don't want to take medicine anymore. So there's a grassroots component that is really strong and powerful. And like both of you were saying, the food addiction piece is really the biggest obstacle we have to helping people improve their mental health and sort of get their lives back on track, their total metabolic health back on track. That's really the biggest challenge we face.
Yeah, I think one of the things that we've seen over the past, and I think it's been a lot of leadership and also a lot of sort of allies, some interest from the central government, the government into metabolic health, mental health. I think mental health got pushed to the forefront from really the COVID pandemic, really essentially bringing out the needs for improved mental health so much. And metabolic health got catapulted, with your help, Chris Palmer's help, and so many others got catapulted to the sort of the main stage. And I think, Bobby Kennedy being in, the administration has also brought some of these issues to life. And it's exciting. I mean, I just saw just this week, Dr. Marty Makary talking about how we need to, change our dietary guidelines and bring them back to evidence-based approaches. It is an exciting time to be working all together, whether we're off doing our podcasts, whether we're off, writing papers, whether we're working with sort of committees and government bodies or publishing, new research. It is like the most exciting time I can imagine to be in this space because change is happening so quickly. What do you think?
And change is happening really quickly. And again, it's because these ideas actually work. So they actually help people, and they help people in ways. I mean, we're really seeing unprecedented results. I can speak, as a psychiatrist, speak to what's happening in mental health. We are seeing unprecedented improvements in mental health across virtually every psychiatric diagnosis. Really doesn't matter what the diagnosis is, because when you feed cells properly and you take care of them properly, they will function at their best for you, regardless of what the diagnosis is. And so we're seeing even complete recoveries, long-standing remissions from even very serious chronic so-called treatment-resistant mental illnesses in people who've been hospitalized before and who have tried, 10 or more medications, and, who had lost hope that there was going to be any kind of real relief, meaningful relief for them. So these are powerful interventions. When you apply the truth about food and the truth about biology and metabolism to your life, you see results very quickly. And that is empowering and brings people hope. That's why I wrote the book, is because I'm tired of people having to accidentally stumble into this information after trying 20 other approaches first. These approaches need to be brought up to people from day one. When they go in to see their clinician about a mental health issue, this approach needs to be on the table from day one, rather than, 10 years later after everything else has failed.
Yeah, and it's amazing that psychiatrists don't talk about nutrition, lifestyle, stress, sleep, and all. It's just like, here's a drug. Are you having side effects? And it's incredible. The more patients I talk to, the more I hear that no one ever talks about lifestyle in mental health.
Well, it depends. It's just like anything. There are good mechanics and bad mechanics in the world. There are mental health providers who are working really hard, and working long hours and under a lot of stress and with very limited tools at their disposal and limited information at their disposal to try to help people. And many mental health providers do talk about lifestyle, and they do talk about sleep, and they do talk about stress. But for an example, they might talk about nutrition. Most of them don't, but they might talk about nutrition, but they don't have the correct information about nutrition.
Yeah.
So they know that food makes a difference, but they don't have the right information about which dietary changes are the ones that are most worth making. And so they're kind of repeating the little bit they might have heard, in a headline or in a guideline, or in the latest paper that, that they may have read. And because most of the nutrition information that we have out there is simply incorrect. So, and then another good example is, well, we know that, sleep is important, right? But how many times did this happen to me in the first 10 years of my practice when someone would say, I can't sleep, I'm waking up at 2 o'clock in the morning, or, I wake up frequently throughout the night, or I can't fall asleep. And, what am I going to say? I'm say, well, of course, we both know sleep is important. And then they say, okay, doc, sleep is important. How am I going to fix my sleep?
Yeah.
So what am I supposed to do about it, right? So I was trained, okay, yes, reduce stress, sleep hygiene, make sure the room is cool and dark, and then you turn off stimulating experiences at least an hour before bed, all of those things. The sleep hygiene, we all gave that talk. And then the other piece was, okay, medication, right? So sleep hygiene only got my patients so far, and many of my patients, it didn't really help at all. And so and then we, of course, turned to medication. Those were the only tools we had. But now we understand, those of us who think about the relationship, the powerful relationship between metabolic health and mental health, we understand that how you eat has a profound influence on your sleep quality. And you can change the levels of stress hormones in your body that are rising and falling overnight simply by changing how you eat. And so that's just one example of how, even if you are talking about lifestyle, you may not have the best information and the most useful information to share.
Yeah, and it's so interesting because I remember early on when Sean Baker was putting all these people up showing, hey, this person's depression, anxiety, and all these testimonials, like, what is it about it? What is it about it? Is it the amino acids? Is it they're not putting all the bad stuff that's in, as we learn, we go, it's a lot of things, not just one thing, right? Being in ketosis is one thing of decreasing neuroinflammation, but you think about, how the gut microbiome interacts with the brain and all these, it's so fascinating. And you say, what is it, taking away all the poisonous bad stuff, or is it putting in good stuff that you need? Is it a combination of those things? What do you think in your experience of working with nutrition so often?
Yes,
so
yes,
long.
yes. It's all of these
Yeah,
things,
it's all
right?
this.
So it's all these things. And the beauty of, if you have if you understand the basic principles, which are really quite simple, nutrition is not rocket science. We're the only creature on earth that seems to have trouble figuring out what we're supposed to eat. It's not rocket science. It's very simple. If you understand the basics, then you're going to correct a lot of problems all at once. Just by changing how you eat, you can rebalance neurotransmitters in your brain, you can reduce inflammation, you can reduce this beast called oxidative stress, which is very damaging to the inside of the brain. You can change your stress hormone levels. You can improve the way your brain makes energy. You can increase the energy level in your brain. You can regulate your sleep-wake cycle. You can heal damaged mitochondria, damaged blood-brain barrier, damaged hippocampus. There's so many things that you can do if you have the right information about food, all on your own without any medications. And it's not that medications don't have a role. There's still a place for medications. It's just that, in my opinion, unless there's a really compelling reason to reach for medicines first, why not food first? Why not lifestyle first? Unless you're in a crisis or you're not capable of changing your lifestyle at that moment for whatever reason, why not a food first approach so that you improve the overall health of the brain, give yourself that foundation, and then see, okay, how far does that take you? because in many cases, that's going to take you where you need to go with either a lot less medication or in some cases, no medication at all. And why wouldn't you want to do that first?
Well, that's the hard thing for a lot of people. They're stressed, so they turn to their cookies and donuts or whatever they're because they're stressed. That's their medication, right? So that makes them worse, and then they need it worse, and then they get hypoglycemic. So we've seen it all. I mean, one case that you was interesting for me. So this lady was 78, and the family they were going to put her in a nursing home because they said we can't handle her. She freaks out, like she has panic attacks all day long, like 4 times a day, and they put her on Xanax. And I'm like, let's put a CGM on her and just see. She was on glipizide. So what was happening is she was getting hypoglycemic, having panic attacks with hypoglycemia. Then I was like, stop that med right now. Just stop it. And then all of a sudden her panic attacks went away. Right. Amazing. But how many of us Americans are like, intros showed this too with people that, that this reactive hypoglycemia, people don't understand that. And they're eating all day so they don't get this hypoglycemia, and they're making their situation worse as they get insulin resistant.
There are so many cases. So you both know this because we've all gone to medical school. A huge percentage of our training in medical school was focused on medication, choosing the medication, managing the side effects of the medication, dosing the medication, understanding the fascinating ways in which they worked, right? But how many of us were taught to look at medications first as the most likely cause of a lot of people's symptoms? And this, we see this every day. And so a good example in psychiatry is the statin medication. So the statin medicines that are used, that are given out like candy to bludgeon people's cholesterol, LDL cholesterol levels into submission, right? So we were trained to look at LDL cholesterol, order a lipid panel, cholesterol panel. It's got a bunch of different numbers on it. We were taught to zero in on that LDL cholesterol. And if it was too high, we were taught to bludgeon it into submission with a medication because the statins do lower LDL. They do. Okay, but is that actually helpful? And does LDL even cause heart disease? There's no evidence of it that I'm aware of. And even if it helped a little bit, even if you look at the studies and you're very, very generous in how you interpret them and you say, well, there is a small potential effect of these medicines in terms of prevention of a second heart attack, that sort of thing. Even if that's true, what about all of the risks involved in taking these medicines? These medicines, they block an enzyme, a critical enzyme in a really complicated, important pathway that doesn't just make cholesterol, it makes all kinds of other really important vital molecules that cells throughout the brain and body need. So the brain, all of these medicines cross the blood-brain barrier to some extent or other. And these medicines interfere with the brain's ability to manufacture cholesterol, which the brain does on purpose. The brain can't get cholesterol from your food because cholesterol is too big and bulky to cross the blood-brain barrier from the bloodstream. So every molecule of cholesterol that's in that brain, and the brain is rich in cholesterol, the richest cholesterol supply in the whole body, every single molecule of that cholesterol is made by the brain from scratch. So on purpose. So, why would I like to say, why would a brain go out of its way to make something that's bad for you? It wouldn't. It's really smart.
Yeah. And that's the more thing you learn, right? As you learn, you go, well, why would your body try to kill you? Why do we get fat? So we don't get diabetes. Like all these things that happen, you go, your body's trying to protect you as much as it can. And people don't know that LDL plays a role in the immune function. It has a lot of roles, testosterone, sex hormones. And so you go, do you want to knock all those things down as you get older and lose muscle mass? So these are all big questions. And I think you're right. Certain drugs, certain interventions, people don't look at the risk. They only go, here's the possible benefit. And you go, wait a minute, let's look at the risk benefit ratio. And that's our job as physicians to discuss those things.
Exactly, the risk-benefit ratio. So let's talk about everything about the medicine, not just this one piece. It's just one piece is the potential very minuscule questionable benefits of these medicines for cardiovascular disease, why don't we talk about how much they raise your risk for type 2 diabetes, which is a more powerful risk factor for cardiovascular disease than LDL could ever dream of being, right? So many different risks. And
that's the stunning part of it too. When you see these elevated insulin, that's your biggest risk factor. Dr. Kraft talked about it, so many people. I'm looking at these studies in Colombia. They did a huge study for a year of people, and they go, the biggest risk is high insulin, but no one checks it. No one checks it because doctors don't know what to do with an elevated insulin. They don't know what it means. And so it's amazing if we go, gosh, if we're looking for the real risk factors, we should be educating ourselves. In the Women's Health Initiative, when you look at all these studies, diabetes, metabolic disease are at the top. Cholesterol is way down at the bottom, LDL by itself.
Exactly. And so the medical education really needs to change because right now, the way doctors are trained, we're not trained to think about normal biology and how cells work. Most doctors who prescribe cholesterol medicines could not tell you the first thing about what cholesterol does in the body. And this is a real problem. And so if we don't understand how the body works, how it works when it's healthy, how can we have any hope of helping people when they're sick? And so, medicines, one of my teachers in medical school, this sentence really stuck out to me. I wonder if either of you heard this in medical school, that this was a pharmacology lecture about medications. And he said, medicines are poisons with positive side effects. And what he meant by that was that all medicines are designed to interfere with normal human biology. And you're kind of exploiting them for the problems that they cause, right? And there may be situations where medication is important, but in most cases, you want to understand why isn't your biology functioning properly in the first place before you throw a monkey wrench into everything with a medicine. Why don't we try to heal the body? Like you said, Brian, the body's trying to heal itself. Cells are trying to get better, but because of the way we live, the foods we eat, the things we drink, the way we live, and because of the medicines we take, there are a lot of things getting in the way, interfering with our cells' natural ability to heal themselves.
I think the biggest con that we face right now in the modern medical profession is, this societal idea to turn to medications, and medications are, and this is a very nuanced discussion, because just like both of you, I believe medications are useful and they have a place, right? And they, it's not like they should be feared. There's always, a calculation that happens, and that's an individual level sort of risk benefit calculation where you sort of you think this through with somebody who's actually spending time to think it through. But what's happened in medicine is there's no more thought, and systematically we've outsourced our thinking to pharma and as a profession, right? And what the insurers do and don't allow. And there's no more conversation about sort of, well, how does this apply to me, right? And what else can I do, right? Like, we were, Brian and I were called incredible names when we said, hey, wait a second, what do we know? We know that diet can improve migraines. We know it can prevent seizures. And we are seeing here in our clinic, I had a patient that gave up a gambling addiction, just gave it up. Doc, I did this diet and I just stopped gambling. He was doing online gambling, going to the casinos. I had another patient who gave up. Now he's like, Doc, I was on porn every day, right? And his testosterone level shot through the roof, went up.
When you feel better and your energy is better, you don't need those things to escape reality. Like we always talk about, like no one's in the middle of a massage saying, "Oh, I need to go eat something." Like you're enjoying the moment,
Yeah.
So
then we had a study showing it even, helps with alcohol withdrawal, right? So we have all of these, if a drug is out there that could prevent seizures, prevent migraines, inhibit appetite, and prevent alcohol withdrawal, it would be a blockbuster, right? I mean, right now, I just got an alert saying GLP-1s are the new best psychiatric drug around,
Uh-huh.
right? I just got an alert yesterday, right? This is the psychiatric drugs, like psychiatrists should consider GLP-1s. And let's go over the reasons why they're considering it, because they're noticing that when people's food changes,
Yeah.
that maybe they want to, they don't want to drink as much. It's a lot of different things change.
But also, Tro, I mean, that's it. So lifestyle change, but also what happens is you don't get that reward pathways blocked, right? So people don't enjoy having sex with their partner or spending time holding hands or talking and having these. So people get these flat. I've talked to so many people and they say their partner, husband, wife, have got this flat affect. They weren't enjoying anything. They lost weight, but they were just kind of going through life and like Eeyore. Like who wants to be a skinny Eeyore?
I think the thing is that these people aren't stupid. They do things for a reason, right? So the reason why people can get into trouble with alcohol and with smoking, with gambling, with other kinds of addictions, they're actually trying to rebalance their brain chemistry.
Mm-hmm.
They're trying to, that's why people use caffeine, that's why people drink in the evening, so they're trying to, they're instinctively reaching for substances to try to help themselves feel better. And so, and this is what the medications do too. So there are medications in psychiatry, the benzodiazepines, things like Ativan and Xanax and Klonopin and so forth. They work in a very, very similar way to alcohol to try to improve the balance between GABA and glutamate in the brain. GABA is kind of the brain's brake pedal, the calming neurotransmitter, and glutamate is the excitatory, stimulating neurotransmitter. It's like a gas pedal and a brake pedal. And so most people are walking around with glutamate that's off the charts and GABA that's being suppressed. So you've got the brain is overstimulated and needs to be calmed, right? And so you might reach for alcohol and it certainly is going to calm your brain because it works just like these anxiety medications do, these benzodiazepines, but it's only going to work for a few hours. And then what are you going to do? And it's going to have side effects, meaning it's going to suppress not just glutamate activity, but it's kind of like a wet blanket that you put over your whole brain where all of the brain cells slow down and become too calm. And then you might not be able to drive, you might get sleepy, you might not be able to concentrate. So there are these these side effects of these effective interventions. And of course, alcohol is profoundly addictive for many people, and so can the benzodiazepines be. So the question is, like, why are things so out of balance in the first place? Why are glutamate and GABA so unbalanced in so many people? And you really need to look no further. There are many things that can do this, but you really need to look no further than the way most people are eating, which is eating diets that are too high in refined carbohydrates and refined vegetable oils that are causing inflammation and oxidative stress throughout the brain. And when you've got too much inflammation and too much oxidative stress, that's going to tip those scales. You're going to get super high levels of glutamate, up to 100 times their usual level. And GABA and glutamate are going to be profoundly unbalanced. Of course, you're going to feel bad. And of course, you're going to want to reach for something that's going to calm you down.
Do you find benefits of supplementing GABA or like 5-HTP, anything like that, like certain amino acids that are supposed to help with neurotransmitter function or neurotransmitter production? Or is just eating meat enough?
Well, I mean, eating meat isn't enough, but I mean, for a period of time in my practice, especially when I was first using a lot of these newer kind of nutritional metabolic strategies that I hadn't been familiar with before, 10, 15 years ago, I was sometimes also using supplements in a few people, 5-HTP and GABA and so forth. But they were kind of hit or miss, like a lot of medications and supplements are. They helped some people, they didn't help others. And B, it really wasn't getting to the root of the problem. It is still kind of the way, at least the way that I think about supplements is that I'd really rather try to correct the underlying problem rather than just kind of add a molecule to the situation. I want to understand what's going on, and I want to try to get to the root of it rather than just kind of cover it up with a supplement. And so one of the issues with 5-HTP, for example, so 5-HTP is what your brain makes. 5-HTP helps it helps make serotonin, right? So it crosses the blood-brain barrier easily, and your brain can use it to make serotonin if the brain is in the mood to make serotonin, right? So just because you give it this molecule doesn't necessarily mean it's going to use it to make serotonin, because all the pathways are very tightly regulated, and maybe it's going to use it for that, maybe it's not. But the other thing is that 5-HTP, because it can stimulate serotonin activity, it can have downsides for people who are prone, to example, to manic episodes. And just like the serotonin boosting medicines do, like Celexa and Prozac and Zoloft and Paxil and Lexapro, those medicines are designed to boost serotonin activity in the brain, and they can really backfire in some people. And so, again, they can be useful in some people, but they're not my go-to. They're not the first thing I would go to.
And you find eggs, if someone's vegan, for instance, and they're depressed and anxious, and adding in eggs, or so they're getting choline, do you see a difference in their depression, anxiety, and sleep?
Well, I have to say, and I've written about this in various places. For many, many years, I worked in college mental health, and most recently, between 2013 and 2018, was at Smith College in Western Massachusetts, where plant-based diets are very, very popular. And I worked with quite a few students who followed vegan or vegetarian diets. But I wasn't able to convince anybody who follows a vegan diet to add animal foods to their diet, because the reason why most students, as in my experience, were following a vegan diet wasn't necessarily for health reasons, although they thought that was a benefit. That wasn't their main goal. Their main driver for avoiding animal foods was for compassionate reasons or for environmental reasons. And those are much more emotional reasons. They're not as biologically based. And so I didn't have any success convincing people to add those foods to their diet, so I can't say. And there are no clinical trials demonstrating that, looking at that question, taking people who followed a vegan diet for quite some time, adding animal foods in, and then seeing what happens to their mental health. So, and there are
it's all anecdotal. Anecdotal. Yeah, it's all
Right.
anecdotal. And then how about, just as a follow-up to that, how about vegans who were eating, tofu and eating like healthier vegan diet versus or raw vegan, whatever, different than someone who's eating Oreo cookies and all that, the processed food versus eating a whole food, plant-based diet?
Right. So there's a whole chapter in the book called that I wrote called The Plant-Based Brain. And it speaks exactly to this question. Yes, there are actually many clinical studies, clinical trials, some of them quality randomized control trials, even demonstrating that a whole foods plant-based diet outperforms a junky, modern, ultra-processed diet with lots of poor quality foods that happens to also include animal foods. And every one of those studies doesn't just improve the quality of the diet, it also improves many other aspects of lifestyle, exercise, stress management, alcohol intake, smoking, etc. And so these studies show that if you make lots of healthy lifestyle changes and you follow a whole foods vegan or vegetarian diet, you are going to be healthier than someone who eats junk. Well, that doesn't surprise me too much, but there have never been any studies, for whatever strange reason, never been any studies where all the researchers do is take two otherwise identical diets and remove the animal foods from one of them. That's never been done.
Exactly. And
And
that's,
they know, and
that
I think I know why.
Well, I have seen, there was a study I saw in Ethiopian, I think it's Ethiopian kids who had a meat supplementation group, a milk supplementation group, and then some sort of vegetarian supplementation group, and they looked at stunting and performance in school. And you can consider the baseline being and like let's say not necessarily a high processed food diet, but maybe a undernourished diet.
Yes.
Yeah, and that study had some pretty good outcomes in terms of the meat supplementation, preventing stunting and increasing IQ. So I think that there's some data, not super clean and crisp as we'd like, but enough to say, hey, wait a second, the statement that vegans have smaller brains, maybe there's some truth to that. Vegans tend to have more mental health issues. Maybe there's some truth to that. Meat supplementation seems to increase IQ and help the brain.
Yeah, but George already said too, and you go, are they just idealistic people already who are maybe already set that way, right, to have some mental health issues? Because most people aren't so cut and dry in what they do. Like when you're super not legalistic, but you're idealistic about certain things, like for instance, global warming. When people are really stressed about it, like it changes their whole, like they go and blow up stuff or throw paint on stuff, and and you go, why is that person like that? Why are they destroying other people's stuff sometimes? So I don't know if that's a predisposition and then the nutrition has some factor, but what I can tell you is a lot of people do a plant-based diet and they're fine for 2, 3, 4, 5 years. It depends on the person. I think maybe their gut microbiome going in, how many antibiotics you take, and all these other factors may be a role too.
I do feel like I should say that I haven't seen any convincing solid evidence that people who follow vegan diet are mentally less well than anybody else. I haven't seen a study that's convinced me of that.
How about your clinical practice?
Again, I mean, everyone that I see has poor mental health, and so they're using all kinds of different diets, right?
Yes,
so
that's true too.
I can't really say, but all I can tell you is that what I do know to be true, because there's been many studies showing this, is that people who follow a vegan diet are more likely to have certain nutrient deficiencies that are very important to brain health. So things like B12 deficiency, choline deficiency, omega-3 fatty acid deficiency, zinc deficiency, iron deficiency. And that's very important to pay attention to. And so that's what I can see. I can't say I wouldn't go as, I mean, I know that it would be, people who are following vegan diets are often eating just as much junk as everybody else. And so we don't have any clean data on that.
Yeah, so I think it's looking at that, say, hey, look, if you're going to be vegan, you don't eat the processed garbage stuff. Like we can all agree on that. Like whatever end of the spectrum you want to fall on, you say, okay, let's get rid of the processed stuff that we know causes neuroinflammation and gut microbiome dysbiosis and all these kind of things. Let's see how we do, because and then however you get your protein source, figure that part of it out, because sarcopenia is a huge issue as we get older, and that's what I'm seeing in seniors who are having fall risk and metabolic disease. We find that if they're putting on muscle mass, they start doing better from a metabolic standpoint, diabetes management, for instance.
Getting from a biological standpoint, a vegan diet makes no sense. A vegan diet is bio-illogical. A vegan diet flies in the face of human biology. And there's no question about that. There are huge holes, nutritional holes in a vegan diet, unless you add lots of careful supplementation and fortified processed foods. You are not going to be able to meet your nutritional requirements. And even if you do that, it is very risky, and I would even use the word dangerous to follow even a very carefully constructed vegan diet during the first 1,000 days of life, conception and early infancy, and even all the way, I would argue, until the brain is finished developing, which is in our early 20s, because there are certain nutrients that are very difficult, if not impossible, to obtain from plant foods that are critical for brain development.
I'm curious, because we're both, I think, we would all love to see more data. I certainly think that nutrient depletion is very critically related to mental health, poor mental health outcomes, and nutrient supplementation likely improves those outcomes. I haven't gone into that data, but I'm sure some of that exists. I wonder, in your clinical experience, I wonder if you just touch base a little bit about how quickly you've seen, people adopting a major lifestyle change, right? And how quickly you see the mental health impact of that. In my experience, and I don't know, maybe Brian, you can give a quick thing, it could be as early as like 3 or 4 weeks where they see drastic improvements. And I'm curious, like how long does it take for you to see a major change? And maybe we can tie that also to food addiction. When you've seen food addiction in your clinic, how long until you see a change in those symptoms?
It really is days to weeks. In some cases, 3 days. And honestly, in some cases, as little as 3 days. On average, about 3 weeks, and at the outside, 3 months. So I say to people, 3 days, 3 weeks, 3 months. If you haven't seen profound benefits by 3 months, then we need to do some troubleshooting, or maybe the issue is not related to your diet. But I've seen multiple times people going down to zero on their mental health scales within 3 days to 3 weeks. And this is the study that you mentioned before, the study that I helped publish, that was conducted in France. My friend and colleague, Dr. Albert Donat, in Toulouse, France, psychiatrist for over 35 years, invited 31 of his most treatment-resistant patients with severe chronic mental illnesses, major depression, bipolar disorder, and schizophrenia. 31 people voluntarily came into the hospital. They were already taking an average of 5 psychiatric medicines. They'd been ill for an average of 10 years, some for as long as 30 years. They'd all been hospitalized 1 or more times before by this very same doctor in this very same health hospital system in most cases, with minimal relief. So yes, they were excited to try something new. So they came into the hospital, and under his supervision, he had the dietitian construct for them a very mildly ketogenic whole foods diet. And within 3 weeks, so there are 28 people who stayed on the diet. 3 of them didn't like the diet and wouldn't continue to follow it. But 28 people stayed on the diet, and 100% of them improved. And that improvement was evident by week 3. And we see this in clinical practice all the time. And 43% of them achieved clinical remission from their so-called treatment-resistant, so-called chronic mental illness. And this was not an epilepsy level extreme ketogenic diet where ketone levels were very high and everything had to be weighed and measured. This was a very simple, very mildly ketogenic whole foods diet.
So it's not that you have to have your ketones at level 2 or 3 or something like that to have the benefit. So just, so who knows how much it is taking out the processed garbage, inflammation, the anti-inflammatory effect of ketones. It's really, really interesting stuff.
Yeah,
it's amazing, because I remember when we heard of Chris Palmer, I'm like, this guy's nutty, True. I don't know. Maybe we should have him on and just talk to him, because he's treating schizophrenia with a ketogenic diet. And I asked him, why would you do that? Like, what made you think about it? He goes, everyone's obese that's schizophrenic that I'm taking care of. And that may be part of this whole metabolic disease thing contributing to that. But he says, like they'll either lose weight or like all the drugs we're using for these patients are seizure medicines. Ketogenic diet works for seizures. Maybe it's hitting the same brain pathways, right? And the people start getting better and interacting and think, wow, it's pretty wild.
Yeah.
Especially the more we're around. I think the more we're learning. It's not Tro's favorite topic, but looking at the gut microbiome, Sabine Hazen has a published case report of a patient with severe dementia that Alzheimer's couldn't interact or give his medical history. They did a fecal transplant on him for C. diff colitis, which is the indication. So I've decided if I ever get dementia, I'm just going to take a bunch of antibiotics till I get C. diff so I can get a fecal transplant. But he improved. He was able to give his history. He understood stuff. He understood who his kids were and his wife. And you go, wow, it's pretty amazing. Just that. No nutritional changes or anything, but his gut microbiome itself. So obviously the food's going to affect that also. And so you start looking at this big picture of how this brain gut, how it all goes back and forth and the communications.
Yeah, I mean, it's not my favorite topic either for a lot of reasons, but I'm curious to know, do you know how long lasting those benefits were?
I don't know. I can call her and find out the long distance, the long term follow up. But yeah, there is some really interesting data with butyrate, which is one of the short chain fatty acids that we produce in our gut, and its effect on neuroinflammation, decreasing neuroinflammation, calming the nervous system, neurotransmitter. It has a lot of effects. You go, wow, once if you're missing that, that's not going to be good. And it's amazing because when you look at obesity, obese people tend to have very low short chain fatty acid production compared to the control or normal weight people. So you go, I wonder how much just getting the gut healthier by taking out the processed food and sugar allows the good microbiome to start making butyrate again.
Well, a really wonderful source of short chain fatty acids like butyrate is the ketogenic diet, and
Yes.
that I think that may be one of its many benefits to gut health.
Yeah, absolutely.
I think there's so much we don't know and so much we're still learning. It's an amazing time to be in the space, to be curious, to be, we have a paper coming out imminently on food addiction and how rapidly the symptoms change, and how profoundly they change, not only with food addiction, with binge eating. And I can't wait to share this at the conference, come September. And I know there's so many lectures coming to that, including you, to this conference in September in the UK, which is going to be focused on food addiction. And what I was happy to see is the mix between sort of, the science and reaching people, which I think is, the beauty of some of these conferences that we put on, where we get to share the knowledge that we all have and we get to, decrease suffering. I'm curious, do you know what you're talking about yet in that conference? Do you know, can you give us a little hint? Just because I can't wait.
Well, I can't wait either. I'm so excited to be participating in this conference with you and to see you there and spend more time with you there. So this is going to be in London, and in early September, 2-day conference at the Royal College of Physicians. It's a beautiful, beautiful building right in central London, on Euston Square. And I attended the conference last year. Last year was the first one. Dr. Jen Unwin and Heidi Aver put on together, and it was an amazing conference. It was very special. The feeling in the room, the sense of community, the excitement about the science. It's not a topic that gets talked about very much. And there was world-class speakers talking about food addiction and just really lively debates around, okay, what causes addictive eating? Is it a particular type of food? Is it a particular molecule? Is it carbohydrates? Is it ultra-processed foods? What kinds of foods can be addictive? Do we even believe it's a thing? It was a really lively and wonderful conference. And so I really encourage people to come. and hear Utro and you're doing really cutting edge work in the food addiction space. Your paper with those 3 cases that you helped to contribute to, this is several years ago now. Those 3 cases that you published of food addiction going into complete sustained remission for 6 months, food addiction symptoms, and helping people lose substantial amounts of weight simply by restricting their carbohydrates to 30 grams a day. That's a landmark case series that I point to all the time in my clinician training program and in my presentations about the power of food. And so I'm really excited about the new paper that you've got coming out, and I'm really excited to hear what you talk about in London. So
Jen Unwin's paper, right? We have to talk about Jen Unwin's paper most recently, a multi-site, multi-center, 1 year sustained improvement in symptoms in food addiction. I think that's a landmark study. My 3 cases is nothing. We have a 45 patient study coming out really, really soon, which echoes exactly what Jen's group showed. And the reality is everything that you're saying, which is giving the body what it needs to heal, giving the brain what it needs to heal, it just improves quality of life and it decreases the burden of mental health symptoms. I can't wait to share our study. I can't wait to hear from you and your lecture. I can't wait to, I have a sneak peek at Jen's presentation, so I know what she's sort of talking about, but all of this stuff is so exciting and I just can't wait. Sorry to interrupt. I'm an excited little boy.
No. This is absolutely. I want to be talking about this with you. It's going to be a wonderful, wonderful conference. And so the title of my talk is going to be When Food Makes You Hungry. And we're going to talk about the hormonal and the hormones and the biochemistry of appetite regulation and appetite control, and how that can go haywire if you have the wrong information about what you're supposed to eat. And so we'll talk about the science and the theory behind it, but then and how processed foods kind of blow past your hormonal stop signs, and just they have no that of course you feel out of control, because your chemistry has been hijacked by these non-food ingredients. They come from whole foods, but they no longer behave like food in the human body. And so it's not your fault that you want to eat everything in sight all day long. It's your hormones telling you that. Hormones are really powerful. And so there's that. And then we've got a special, we just arranged for this yesterday. So it's brand new information about the conference is that, so my time block is 45 minutes. And I was just telling you about Dr. Albert Denal, who conducted this study in France that we published together. He is going to come to the conference. And so I asked him if he would join me to present with me, because he has some really fascinating cases of ketogenic diet helping people with food addiction, including a child and an adult. And these are beautiful stories. He's doing some really groundbreaking work right now in his clinical practice. He has hundreds and hundreds and hundreds of patients that he's known for decades. And he has become motivated quite recently to switch as many of those patients over to a ketogenic diet as will agree to it. So he's got 70 people that he has switched over to a ketogenic diet, all kinds of different diagnoses, and he's seeing really remarkable results. So he's never spoken at a conference before. So it's going to be a really wonderful presentation where people will get to meet him for the first time.
Can't wait. I can't wait. That's exciting, absolutely exciting.
Yeah, and I would tell people listening, like when we talk about food addiction, one of the eye openers for me, because I at the time, this episode 10, Tro, we're on episode 403 that we published. I just looked. Episode 10 with Rob Sivas when he was talking about it, and I go, yeah, I don't know if it's addictive. He goes, okay, say you went to an all-you-could-eat steakhouse and you eat all the steak you can and you're stuffed and you feel stuffed, and someone brings another steak, you're going to look at it and say, no thanks, give it to someone else, or I'll take it home, I'm not eating, I'm done. But he said, instead of the steak, they bring your favorite dessert, and all of a sudden you say, oh yeah, I could have some. Right? Because you overrule all your brain. And part of it, like what you were talking about, Tro, hyper palatable foods, like where things are so delicious and you love it, you're going to eat it no matter what. And I just saw someone post that said, if you have something in your house that you're going to eat when you're not hungry, just because you like it, get it out of your house. Right? Then that's good advice, because it's that. No one says, oh, I'm going to go eat sardines tonight at 10 o'clock. No one's craving that. I don't think. Some people do, I guess. But for the most part, it's pretty amazing how it's all these hyper processed foods and sugary foods. And, it's amazing how much addiction, how much is, that we're hungry, that our hunger signals are off and our dopamine's off and all. There's so many factors involved. So it's amazing just to see that we can have success.
Yeah, there's somebody in my life who likes to say that when it came to sweets, she had a second stomach.
Yeah.
It's like, oh, there's always room
There's a
for
second
those
stomach.
things.
Yep. Yeah.
I absolutely can't wait, to go to this conference with you. I'm so excited. I hope the listeners out there, if you guys are, remotely interested in food addiction, want to see London, come join us. I already know 2 patients of mine that are coming. So that's going to be exciting. And if you're just interested on the topic, you can get and we'll include the link. Jack will put the link for the live stream. It's going to be amazing. And in the show notes, we're definitely going to put your book, Georgia.
Yeah, change your diet, change your mind. I recommend it. Everyone read it. Like if you're struggling with mental illness, you have family members, or you're trying to get healthier, it's outstanding. It's really goes through all these things we talked about plus a ton. Yeah.
Thank you very much for letting people know about it. Yeah, it's we're getting it translated. It's now available. It's going to be available. It's already available in 6 languages. It's going to eventually be available in 11 languages, and we're getting new contracts every week. So
awesome.
We really are trying to get the word out, because it's about giving people hope and empowering people to improve their own mental health with less medication and with the right information. So thank you for helping me tell people about that.
Well, we're selfishly doing that because for me, the best thing that we treat is mental health. When we see someone who's stressed, anxious, like you said, has no hope, when you can give them hope and they say, hey, maybe I can get better. Maybe there is a chance I can. The worst thing for someone to hear, like Matt Baszucki, it was like, you're refractory to all treatments. There's nothing we can do for you. It's like, oh my gosh, like that's horrific. Right. And then he made some lifestyle changes and he's functional again.
Well, yeah, that's the thing, is that these are really powerful interventions. And people often think, oh, it's just diet and exercise. Yeah, I mean, it's going to be kind of a fluffy intervention, not going to help that much. The reason why people think that is because the types of dietary changes that we've been told are supposed to work, they don't really work. And so people think, well, I mean, food doesn't matter. I tried putting more blueberries on my oatmeal. I tried eating a little bit less. I tried cutting out soda, and I tried eating more whole grains. It didn't work. Well, of course it didn't work. It doesn't make any sense that it would work. So, but if you make the right changes, like we were talking before, days to weeks, and your cells will thank you in ways you can't even imagine.
Amen. Yeah, absolutely. It's changed my life. I know, Georgia, it's changed your life.
Yes.
Brian, I know it's changed your life. And it's such an honor to be able to share it with the world, share it in our clinical practice, share it with all our works, the interviews that we do, Brian, the written work you've done, diagnosisdiet.com, amazing resource that you've just put out there for the whole world, and your book. Just thank you to you both. Grateful for you both. And I just can't, I have to say it again. I look forward to seeing you in just a couple of, wow, it's not even that far, not even 6 weeks away.
Yeah, I mean it's going to be in early September. The date I can't pull out of my brain, unfortunately, right now, but I think it's the
4th, 5th, Yeah,
It's the
third, fourth.
first weekend of September, right?
Yeah.
And yeah, and it's going to be it's going to be an amazing conference. I hope people will come. There's nothing like going to a conference in person. Watching it online is great, but being there in person, it is just, there's something special about that, being able to interact with other people, meet all the speakers, talk to all the speakers talking to each other. And you come away having new relationships, new networking opportunities, new collaborations, inspiration. A lot of people come away from conferences and then they stay friends, or they stay connected, or they start working together. And we're not just talking about the speakers here, we're talking about the attendees. They form support groups, they stay in touch, sometimes they even they end up changing careers, having heard a really inspirational talk or had a really great conversation in the hallway. All the magic in conferences, it's not just about the lectures, it's about all the stuff that happens in between the lectures. When people are having lunch together, or standing in the hallway, or sharing a cab or a train somewhere, that's where a lot of the magic happens. So I hope that people will take advantage of it, because this conference is really special.
Wait.
Yeah, there's that human connection, and being able to talk to people and ask questions that you're always wondering. It's just amazing. Like, I love those conferences too. We were just talking about the Society of Metabolic Health in San Diego. Having that one's coming up in August, and one whole day is mental health. I mean, neurology. Like traumatic brain injuries, Parkinson's, dementia, and you think, wow, this is amazing. Because that first conference when I met you, all we were really talking about, except for you, was diabetes management, weight loss, those kind of things. And back then everyone was saying, well, you don't have to exercise, just eat a ketogenic diet, and that's fine. And you start realizing how people realize you got to exercise, you got to get your sleep, watch your stress, enjoy life, laugh sometimes. All these things have a huge role on our entire physiology.
Yeah, I mean that's where the magic happened so many years ago in San Diego. That's where I met you, Brian, was not during a lecture, right? We met after a lecture when we were sharing a meal together. And that's one of the wonderful things about these conferences, and why we spend so much time and money and energy flying to these places. And even though sometimes it's stressful to do that, we do that because it makes a difference to connect with people in person. And my favorite thing about conferences is having people come up and ask questions and talk and share their stories. And I mean, I get so much out of that, that it's really become an important part of my year to go to these really wonderful conferences.
Can't wait.
Yeah,
I
it's
can't wait.
awesome. Yeah, thanks so much for joining us again. It's always great to see you, and thanks for all you're doing. This is the forefront. I think the mental health is the forefront of what we're talking about. We're in a major catastrophe right now. We're seeing it in our practices, and drug abuse, and spousal abuse. All these things are the frustration, and so hopefully we can get everything balanced out for people and get everyone happier around us.
Thank
I
you
think that's
so
such a huge
much.
thing.
Thank you so much for all the work that you do in your clinical practices, but and also publicly, to get the word out about how important these fundamentals are, because the people actually have so much more power, more control over their mental health and their physical health than they realize.
Yeah. Yeah, absolutely. Absolutely. We got to get people evangelized. They need to take their health back. Sleep, movement, solid nutrition. These are the pillars. Great community. Don't lose hope. Prize your mental health. Thank you so much, Georgia, for coming. And I can't wait to see you in a couple of weeks.
Looking forward to it. Thanks.
If you enjoy the show, please consider supporting us on Patreon by going to lowcarbmd.com.